Yeah, well, good. The GP, she said Zaza or something. Yeah, I think she's sleepy, very sleepy. Where? You can give the question name over, isn't it?
Oh, yeah, I just need to
We get
actually.
Yeah, but I can't put them back up on the monitor there.
No.
And what I normally like to do is to set the calibration at the beginning of the pullback, and the way we do that is that we click here in the bottom left-hand corner, adjust calibration. And it's very self-explanatory. That's the nice element of this system, that it's very intuitive and gives you clear instructions. So it says use the control points to size the calibration circle to match the outer surface of the catheter sheath. And we can see here that is the outer surface of the catheter sheath. There it is. So we need to position our points to the outer surface of the sheath. There we go. So our patient today is a 59-year-old gentleman that has a past history of ischemic heart disease, having had a stent to his LAD back many years ago. He presented to me in April this year with an acute lateral ST elevation myocardial infarction. And I went on to stent an occluded proximal circumflex artery. He did have, however, quite significant disease also in the left anterior descending artery, both within the stent previously implanted, but also distal. So what I'd like to do now is just show you his angiogram images. So this is his left caudal spider shot, and here we can see that what we've got at the moment is a 7 French guide. It's got obviously the near infrared light source, and there are two markers, a proximal and a distal marker, which are 20 millimetres apart. And what we'll do now is we'll advance this over the guide wire in a method analogous to intravascular ultrasound. The catheter itself has got a very short monorail tip, so it will exit quite quickly. Okay, so that was much better. Couple of points, and what I did between the first and the second pullback is that I just got the guiding catheter sitting nicely into the left main coronary artery. But you can see there the stented segment with an abundance of endothelial coverage with a lot of lipid and plaque. And we'll go through in detail after the procedure the specifics of this case. So the procedure itself is undertaken during systemic anticoagulation. On this occasion we've given heparin, but you can use bivalirudin, and the patient is already on his dual antiplatelet therapy, having had a recent stent a few months ago. So in moving on to the percutaneous intervention, what we've done is that we've pre-dilated the lesion with a 2.5 millimetre balloon. There are actually two discrete lesions there, and I've had the chance to look at the OCT itself, and there are actually two very calcified lesions with a lot of lipid. So we're going to go over a long segment, probably sort of 30 millimetres of stent to cover both.